Hair loss can be quite bothersome, but in some cases a person may cause the hair loss by himself or herself. It's called Trichotillomania. It's a mental condition that we'll be discussing in this video. I'm Dr. Mazhar Hussain. Do click the notification bell, stay updated with our videos, subscribe to our channel, and do share this video with your friends and family. So we are talking about trichotillomania. Trichotillomania is a mental disorder where you see a recurrent, irresistible urge to pull out hair from the body. It's usually the scalp or the eyebrows, but it could actually be any hair-bearing part of the body. It can be from a very mild situation to a much more severe condition, and you can have hair loss that is limited to a small patch or far more extensive hair loss that is causing social restrictions on the patient. But this is a condition that's inflicted by the patient onto him or herself, of course not willingly, but it so happens. What we do see, we don't really know specifically what the cause of trichotillomania is, but there seems to be some genetic factors. It is more common to see it in people with a first-degree relative that has the same condition. It's also more common in preteens or early teens and teens, but it can actually be seen later in life also. It has certain associations with depression, anxiety, and obsessive compulsive disease. We do see a lot of these diseases found together. If you are having trichotillomania, chances are that a good number of those people would also have depression, anxiety, or obsessive compulsive disease. There is also some association with attention deficit hyperactivity disorder, ADHD, and stress may trigger the trichotillomania. So it is an emotional disorder, and it can be a reflection of negative feelings, stress, anxiety. It can be loneliness, frustration, and boredom. It can also be a positive feeling. The feeling of pulling out hair can be satisfying, and it can also relieve tension for the patient, and it can relieve the patient's anxiety. It can be a way of the patient to kind of control those feelings that were negative. So that can be part of it, the positive feeling. The signs and symptoms of trichotillomania is pulling of hair from the scalp, eyebrows, or any other part of the body where you have hair. There's a buildup of psychological stress, of tension, of uneasiness before pulling out the hair, or if the patient tries to resist the urge to pull out the hair, it can lead to some kind of psychological stress and being unwell. We see, of course, if they pull out the hair, we see hair loss in the scalp, eyebrows, eyelashes, or other part of the body where the patient may be pulling out the hair from. It can be limited, it can be more extensive hair loss. It's not uncommon for the patients maybe to play with the hair once they've pulled it out. They might be stretching it, manipulating it, they might be biting it, and they could also be eating it once it's pulled out. It's very characteristic for a lot of these patients that if they're aware of it, sometimes they may or they may not be aware of it, but if they're aware of it and they try to stop it, they still have the psychological tension, the stress that is building up, the anxiety that is building up if they try to stop it. And often it's not easy to stop it. It can also cause a great deal of social distress and discomfort, and at work, it could be at school or any other places. The patients can often be biting their nails, they may be picking their skin or biting their lips also. And most patients would try to do the hair pulling in private and try to disguise it, try to cover it up, try to hide it so that nobody knows. Keep in mind, some patients will do this deliberately and some will be doing it unconsciously. It doesn't have to be either of them. It could be in some situation the patient is deliberately pulling out hair. In other situations, the same patient may actually not be aware that they're now playing with their hair and they're pulling out their hair again. It could be while they're bored, maybe they're watching the TV, they're setting up their hair. It could also be when they're under distress, under stress, when they don't feel things are right. It can also cause them to pull their hair. Again, could be conscious, could be unconscious also. It can be a condition that's very hard to treat. The patient may have tried on his or her own and still not being able to do it. The success rate for treatment varies greatly. Psychological interaction and intervention can be required, and some method called habit reversal therapy can be tried out. It has some positive impact, but maybe not as much as we would want it to be. There are some medicines that can be used, but there are limited studies and the success rate is variable, and there are certain medicines that are tried out in these patients, and as I said before, it can also be seen in cases of depression, anxiety and obsessive compulsive disorder. So it could be worthwhile in that situation to try out medicines for various psychological problems and see if that can relieve fully or partially the symptoms with trichotillomania. So this was our video on trichotillomania. I'm Dr. Mazhar Hussain. Do subscribe to our channel, click the notification bell so that you're updated with our videos, and do share this video with your friends and family. Thank you.